training on understanding trauma. So let's go ahead and get started. We're just going to jump right in and we're going to take a look at our objectives for today. So the objectives are for you to become knowledgeable of the leading causes of trauma, to better intervene with clients experiencing trauma, to increase your knowledge of how to screen for trauma when working with clients and their families, to understand screening for adverse childhood experiences and how they impact clients with other traumatic experiences, and then lastly, to become familiar with the 3 R's of trauma and how to successfully get to a resolution or a healing. So we're going to start off by actually watching a video. So this video, this video comes from Bessel van der Kolk, and he is going to guide us through what trauma actually is, what it looks like. So we're going to take a couple of minutes and start off here.
The most important thing to know is that there's a difference between trauma and stress. As I like to say to people, life sucks a good amount of the time. We all have jobs and situations that are really unpleasant. But the moment that situation is over, it's over. The problem with trauma is that when it's over, your body continues to relive it. My name is Bessel van der Kolk. I'm a psychiatrist, neuroscientist, and author of the book, The Body Keeps the Score. I got interested in trauma on my first day working at the Veterans Administration. 1978 was the year, and the Vietnam War was over by about 6 or 7 years. The very first day that I met Vietnam veterans, I was just blown away. These were guys who were my age, who were clearly smart and competent and athletic, and they clearly were just a shadow of their former self. Their bodies were clearly affected by trauma, and they had a very hard time connecting with new people after the war. Around that time, a group of us started to define what trauma is. And in the definition of PTSD, we write, these people have been exposed to an extraordinary event that is outside of normal human experience. In retrospect, that shows us how ignorant and narrow-minded we were, because it turned out that this is not an unusual experience at all. People usually think about the military when they talk about trauma, but at least 1 out of 8 kids in America witness physical violence between their parents. A larger number of kids get beaten very hard by their own caregivers. A very large number of people in general, but women in particular, have sexual experiences that were clearly unwanted and that left them confused and enraged. So, unlike what we first thought, trauma is actually extremely common. There's a lot of debate of what a trauma is to this day. But basically, trauma is something that happens to you that makes you so upset that it overwhelms you. There is nothing you can do to stave off the inevitable. You basically collapse in a state of confusion, maybe rage, because you are unable to function in the face of this particular threat. But the trauma is not the event that happens, the trauma is how you respond to it. One of the largest mitigating factors against getting traumatized is who is there for you at that particular time. When, as a kid, you get bitten by a dog, it's really very scary and very nasty. But if your parents pick you up and say, "Oh, I see that you're really in bad shape. Let me help you." That dog bite doesn't become a big issue because the foundation of your safety has not been destroyed. We are profoundly interdependent people, and as long as our relationships are intact, by and large, we're pretty good with trauma. It's a subjective experience, and what may be traumatic for you may not be traumatic for me, depending on our personality and our prior experiences. The problem with trauma is that it starts off with something that happens to us, but that's not where it stops, because it changes your brain. Much of the imprint of trauma is in that very primitive survival part of your brain that I like to call the cockroach brain. There's a part of you that just picks up what's dangerous and what's safe. And when you're traumatized, that little part of your brain, which is usually very quiet, continues to just send messages. I'm in danger. I'm not safe. That event itself is over, but you continue to react to things as if you're in danger. We're talking about survival. We're talking about staying alive. And so some people go into fight flight, or on a more primitive level, people's brain shuts down and they collapse. You have these automatic responses that are not a product of your cognitive assessment, they're a product of your animal brain trying to stay alive in the face of something that that part of your brain interprets as a life threat. And the problem then becomes that you are not able to engage or to learn or to see other people's point of view or to coordinate your feelings with your thinking. Traumatized people have a tremendous problem experiencing pleasure and joy. But the core issue is our hormones and our physiological impulses that have to do with survival. Your body keeps mobilizing itself to fight. You have all kinds of immunological abnormalities, endocrine abnormalities, and that really devastates your physical health also. Oftentimes the physical problems are longer lasting than the mental problems. And the other thing that is terribly important is the impact of poverty, or the impact of racism, or the impact of unemployment. There's other societies that are much more trauma savvy than we are, where there is not an enormous amount of income inequality. Healthcare is universal, childcare is universal. A culture like that really looks at what are the antecedents for certain forms of pathology. So the big issue is a political issue. How do we rearrange our society to really know about trauma so that people who grow up under extreme adverse conditions can become full-fledged members of society? The sense of community and people being there for each other is a critical part of surviving and thriving.
Get smarter fast.
Okay, so that was a great introduction video into what trauma is. So when it comes to trauma, trauma is extremely common. But when your body continues to relive that stress for days, weeks, months, or even years on end, that stress changes your brain and it creates trauma inside of your mind. And that trauma can eventually manifest in your physical body. So the problem with trauma is that it starts when something happens to us, but that's not where it stops. So it changes your brain. Once your brain changes and you're constantly in a fight or flight mode, it can be hard for you to stay focused. It can be hard for someone who has experienced trauma to feel joy or even experience pleasure until their trauma has healed. So The definition you see on your screen comes directly from the Substance Abuse and Mental Health Service Administration. So it states that individual trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or threatening, and that has lasting adverse effects on the individual's functioning and physical, social, emotional, and spiritual well-being. So events and circumstances may include the actual or extreme threat of physical or psychological harm, or the withholding of material or relational resources that are essential for healthy development. So events and circumstances may occur as a single occurrence, or they can occur repeatedly over time. So, according to the American Psychological Association, trauma is defined as a single or series of events that involve or threaten death, serious injury, or sexual violence, and that have a profoundly distressing or overwhelming impact on the individual's ability to cope, resulting in significant, long lasting changes in behavior, cognition, and emotionality. So this definition encompasses experiences such as what you see on your screen, like sudden or traumatic events, death, or anything that disrupts a person's sense of safety. So trauma can have a significant impact on an individual's mental health, their well-being, and their overall functioning. So it's important to note that the definition of trauma can vary depending on the individual, and it can also vary depending on an individual's cultural context. So let's look at a few of the different types of trauma. So here first we see physical, sexual, and emotional abuse. So physical abuse is actually one of the most common forms of trauma. Whether the abuse comes from a partner, a child, or another person that is close to the individual, whoever it is, it can cause trauma for that individual. Living in unstable or unsafe environments, that can lead to trauma, impacting physical and emotional well-being. Separation from parents can be profoundly traumatic experience for children, leading to a range of emotional, behavioral, and even developmental difficulties, including anxiety, depression, or difficulties with social functioning and attachment. Witnessing violence or being directly involved in a violent act can be traumatizing. Childhood neglect can have a lasting negative impact on a child's development. People with serious illnesses may have higher prevalence or trauma histories, and their experiences with healthcare in general can be further traumatizing. Intrusive or invasive medical procedures can lead to medical trauma. Then we have both natural and human-made disasters. Those can cause trauma, leading to a range of psychological reactions, including PTSD, anxiety, and depression. And then lastly, we see here severe motor vehicle accidents. Those can lead to physical injuries, of course, but it can also cause lasting psychological trauma, including PTSD. So when it comes to trauma, trauma is subjective and relative, meaning what one person considers traumatic, another person may not. So even if two people are experiencing the same event, they can have different impacts, and different individuals can look at the factors and look at their different past experiences, and it can really depend on what coping mechanism someone has already. So what constitutes as a traumatic event is not universal. An event that one person finds, again, deeply distressing or overwhelming, another person might just view that as like, oh, it's just a minor setback, or maybe they even look at that experience as a learning experience. So for example, if you have two people in the same car accident, you can have one person who can walk away from that accident and they can feel perfectly fine. They're able to sleep throughout the night, nothing's wrong, and they get up the next day like nothing happened. But you can have a second person who was in the same vehicle and in the same accident, and it could take them a long time to even get back into a vehicle, or they may experience some type of sleep disturbances where they're having nightmares or they're just not able to sleep throughout the entire night. They can be reminded of the accidents on a regular basis. So that just shows you that two people can be involved in the same situation, but one person can find it traumatic while the other person's just like, oh, it's just another day. Okay. So let's begin by looking at the correlation between trauma and child development. So trauma, it significantly impacts child development, potentially causing impairments in brain development, social, emotional regulation, and academic performance. So unaddressed trauma can lead to long-term challenges, including relationship difficulties and even risky behaviors. So child development theories, they focus on explaining how children change and grow over the course of their childhood. So these theories offer the framework to understand how children grow and learn, encompassing various aspects like cognitive, emotional, social, and physical development. So some key theories come from psychologists Jean Piaget, Gordon Allport, Lawrence Kohlberg, and Erik Erikson. And Erik Erikson, he was actually a psychoanalyst. But you can see here the diagram on your screen along the left-hand side of the diagram. Those are the different age ranges. And then across the top and to the right, you can see how each psychologist or psychoanalyst described that particular stage of development. So Piaget, he proposed an idea that children think differently than adults. So his theory provides the framework for understanding how children develop cognitive abilities. And then Allport, he focused on the different traits that make up personality. So his approach favored emphasis on the problems of the adult personality rather than on those of infantile emotions and experiences. And Kohlberg, he focused on how children develop morality and moral reasoning. So he looked at the thinking process of when a child decides whether a behavior is right or wrong, and how a child decides to respond to a moral dilemma, not what the child actually does. And then Erik Erikson, he focused on social interaction and conflicts that arise during different stages of development. So he looked at what age or stage we develop trust, self-control, self-worth, cultural values, personal identity, and even intimacy. So childhood trauma can significantly disrupt the healthy development of a sense of self and autonomy. So impacting the individuation process, which is crucial for forming stable identity and for forming healthy relationships. So when we talk about individuation in a developmental context, that refers to the process of developing a distinct sense of self, which is going to be separate from your parents or separate from the primary caregivers. So it's a vital part of healthy child development, particularly during their adolescence years. So during those adolescence years are where individuals start to explore their identities and they start to explore different relationships. So certain developmental tasks may be missed or incomplete when a child has experienced abuse because all of their energy is now focused on the task of just surviving in what they perceive to be a threatening environment. So here on your screen, we have the 5 different types of impact on trauma. So we're going to go over these 5 today. So the 5 we're going to go over are affective, cognitive, behavioral, physical, and psychobiological. Psychobiological, excuse me. Okay, so let's start with affective impact. So trauma can significantly impact a person's emotional well-being, leading to a range of negative affective responses such as fear, anxiety, anger, guilt, shame, and even a diminished capacity for positive emotions. Excuse me. So trauma that can trigger or even intensify negative emotions. Some individuals may experience emotional numbness or detachment, making it difficult to feel emotions, including positive emotions, even like the birth of a child or purchasing their first home or even getting married. Those are all pretty positive experiences, but trauma can have a negative impact on how people perceive those things. Now let's get into behavioral impact. So when it comes to responses, most responses to trauma are a normal attempt for someone to cope to a triggering event. So, however, some responses can be risky. So traumatic stress reactions or responses can vary. So often people engage in behaviors to manage either the after effects of trauma or the intensity of the emotions they're facing due to the trauma, or even the distressing aspects of the traumatic experience. So some people reduce tension or stress through avoidance, where they may avoid the situation altogether, or they may not even talk about the situation anymore. Some people self medicate, they may abuse alcohol or drugs. Um, some people, we could see some people engage in compulsive behaviors like overeating or impulsive high risk behaviors, or even self interest behaviors. Others may try to gain control over their experience by being aggressive or even subconsciously reenacting different aspects of the trauma that they experienced. So now let's get into cognitive impact. Excuse me. So after a traumatic experience has occurred, this is when people typically start to search for answers. They need to find an explanation as to how and why something happened. If they're not able to find the answers that they're looking for, or if there is no rationale as to why something happened, excuse me, this is where we begin to see irrational beliefs start to form. So traumatic experiences, those can affect and alter cognitions. So trauma inherently challenges the fundamental, often unconscious assumptions that people hold about the world or how they look at themselves and others. Basically, it's disrupting the just world belief system. So the just world theory assumes that people want to believe that they live in a world where good things happen to good people and bad things only happen to bad people. So, for example, it would be difficult for us to leave the house in the morning if we believed that the world was unsafe or if everyone outside of our home was dangerous. Um, or even that if life holds no promise whatsoever. So those types of beliefs are beliefs that someone's efforts and intentions can protect them from bad things makes it less likely for an individual to perceive personal vulnerability. So however unexpected traumatic events can challenge those beliefs. So let's look at some examples of cognitive impact. So the first one we see here is self-blame. So this is the tendency to attribute responsibility for a negative event or outcome to oneself, okay? So whether the individual blames themselves for the event that happened, or maybe they blame themselves for failing to foresee it from happening or even prevent it from happening. People also start to look at themselves as maybe being bad or as if they're lacking in some form of or another. They start to justify what has happened, especially when what has happened is inconsistent with their actual beliefs and values. I'm experiencing betrayal by one person can lead to a generalized belief that no one is trustworthy. Okay. And when people start to believe that they can't trust anyone, that's when they start to have difficulty forming healthy relationships. And then lastly, you see here, if someone is religious, it may lead them to modify their religious beliefs if they experience trauma. Okay. And then we have physical impact. So trauma can have significant physical impacts, manifesting as things like headaches, muscle tension, fatigue, stomach or eating problems, sleep disturbances, increased heart rate, as well as potentially leading to chronic health issues like heart disease and high blood pressure. So there's also a connection between trauma, adverse childhood experiences, or ACEs, and chronic health conditions. If you are not familiar with ACEs or adverse childhood experiences, don't worry, we are going to cover that further on within this training. And then lastly, we have, when discussing the 5 impacts of trauma, we have psychobiological impact. So the structure of the brain is dynamic. So what that means is that the brain structure is interactive with brain functioning. So stress will trigger a cascade of physiological responses through changes in neurotransmitters and hormonal activity. So you can see things like an increased heart rate, maybe you start to perspire, blood pressure increases, and you are hypervigilant, which is all of those things are mediated by the release of hormones like adrenaline and cortisol from the adrenal glands. And then lastly, we see here childhood trauma and PTSD are linked to chronic physiological changes as well. So traumatized children or children who have experienced trauma can have higher resting heart rates. They can experience higher blood pressure readings. They have increased physical tension. This is all reflective of the fact that their body is in a sustained stress response mode. Every thought, feeling, and action that we have is linked to brain activity, and traumatic events can disrupt this normal functioning. So trauma can significantly alter brain function and structure, potentially leading to long-term symptoms and cognitive impairments. So research has shown, it indicates that children who have experienced interpersonal trauma, they may have smaller brains, their IQs may be lower, they may receive poorer grades in school, or they may even have a higher disassociation scores compared to those without any trauma history. Okay, so now we're going to watch a video on the hand model of the brain where Mary Vaccaro, or Vaccaro, whatever her name is, she's going to use her hand to illustrate brain functions and how trauma can disrupt the connection between the upstairs brain and the downstairs brain. So give me 1 second, let me pull this video up. All right.
And it's been my joy to be a part of the Resilience Project for the last 5 years. Today, I get to talk to you about the hand brain. And I love it so much because it allows me to bring a model of the brain with me wherever I go. And I'm Italian, so I talk with my hands. So it's just a win-win all around for me. Feel free to do this with me. Between your wrist and your elbow is your spinal column and something really important called the vagus nerve. So the vagus nerve actually releases all of our feelings into every organ of our body. So literally, we feel our feelings in every organ of our body, and we don't get to decide when that happens. It just does it. Not in those thoughts that we're so proud of, but in these feelings. The next part of our brain is the brain stem. It's the palm of our hand, and it's in charge of all the things we don't think about, all the things that keep our body going that we don't think about. For example, breathing, digestion, bladder and bowel control, which means that's not under your conscious control sometimes. Arousal, the type of arousal that hopefully has you awake right now while you're watching this video, and the type of arousal that makes you want to do things far more interesting than watch this video. It's also in charge of how much information enters your brain. And if you're on the autistic spectrum or you have trauma, it actually lets in extra information because it doesn't know what you're going to need to be safe. And that extra information can become very overwhelming very quickly. In fact, it makes all your senses stronger, so things are brighter and louder, and they feel weird in your mouth, and your clothes feel weird, and get very stressful. And the other reason it can get very stressful is that all the information that enters our brain goes immediately to our fear center, which is the next part of our hand brain, which is our thumb. The fear center, also known as the limbic system, is in charge of three very important things that I like to remember through the word FAR. It's in charge of felt safety, attachment, and regulation. And it likes things to happen in that order, in fact. So when the information comes into the brain, it immediately goes to the fear center and decides safe or not safe. And if it's not safe, it keeps our thinking brain offline. But if it is safe, it lets the next part of our brain, our cortexes, our thinking brain, come online and give it a hug. But when it's not safe, throws it offline. So when you're not feeling safe, it doesn't allow you to attach and work cooperatively with others. And when you can't attach and work cooperatively with others, it also doesn't allow you to regulate. And you can look like you're out of control. And it might look like a choice, but when your fear center's in charge, it's not a choice, because what it has thrown offline is your thinking brain, which wraps around the fear center and has all those wonderful thoughts and all those wonderful things we've practiced doing housed in it. But when the fear center gets afraid, throws it right offline. And the only part of our brain we have conscious control over is our thinking brain. So when our fear center throws it offline, all of those thoughts we're so proud of and that we've worked so hard on to help us control our behavior, they are out of our reach. And if the fear center can't tell, should I be afraid or not afraid, it always errs on the side of fear to keep you alive. So we want to find a way to get a message from the thinking brain to the fear center so they can work together when we're afraid. And we're going to look at how to do that. So our vagus nerve and our brainstem think in sensations and feelings. Our fear center, our limbic system, thinks in feelings and pictures. And our thinking brain thinks in pictures and words. So you may have guessed it, the passport from the fear center to the thinking brain are the pictures. When we can create a picture for what we want, we have a better chance of getting a message to that thinking brain, bringing it back online so it can hug our fear center and help us feel safe again.
Okay. So as we saw, the hand-brain model, it helps to explain how traumatic experiences can lead to dysregulation in individuals where the downstairs brain becomes dominant and the individual struggles to access their rational thinking. So what can happen as a cause of trauma? So some clients with trauma histories can respond to their past trauma in the present. So sometimes they may struggle to discern that the context has changed in that moment. So leading to their reactions to seem disproportionate, or maybe their actions are just out of place. So for example, if a client has experienced a loss in their life, they might become overwhelmed by sadness or anxiety if they're experiencing the current loss, but the situation is different. So their experience is different. So it seems like their experience is out of context in that moment. Or some clients may start to blend multiple traumatic experiences together. Some clients, their responses or coping mechanisms can be described as maybe defensive or maybe they're protective, as they're used to avoiding uncomfortable situations or emotions. So they can react in a way that shields them from perceived threats or criticism. Essentially, it's just their brain is trying to protect itself, essentially. So we can also start to see maladaptive behaviors start to form after trauma. So maladaptive behaviors are behaviors that stop a person from adapting to new or difficult circumstances. They can start to form after an individual has experienced maybe a major life change, maybe they've experienced some sort of serious illness, or even, of course, like after a traumatic event. So trauma can also lead to a wide array of emotional, psychological, and physical consequences. So those can include some things like what you see here on your screen, like unstable or poor peer relationships. Maybe the individuals start to lack trust in others, or they have difficulty concentrating. There could be some educational delays, or even lack of self-control or confidence in their self, or they may even become, there may be some opposition to authority or loss of meaningful relationships. So here on your screen, we see Maslow's hierarchy of needs. So this hierarchy, this outlines human motivation. So it goes from basic physiological needs like air, water, food, shelter, things like that, and it goes all the way up to self-actualization. So this can be a helpful framework for understanding how trauma impacts individuals. Trauma can disrupt the ability to meet even the basic needs, potentially hindering the progress of the hierarchy. So again, this hierarchy of needs, it starts with those basic needs, and then it progresses to safety, then love and belonging, then esteem, and then lastly, self-actualization. So trauma, again, that can disrupt this hierarchy, and it can cause individuals to start to struggle with even basic needs like safety and security. So with trauma, it's often necessary to address the lower levels of the hierarchy and make sure those needs are being met before moving on to a higher level of needs. Okay, so we're going to watch a short video this time from Mary again as she discusses 3 R's of trauma resolution.
Now, I get to talk with you about the 3 R's of successful trauma resolution. The first R is re-experiencing. The second R is releasing. And the third R is reorganizing. But before we get onto the path of the 3 R's of successful trauma resolution, we have to look at where we meet the people we serve, because they're not on the path yet. They're still caught in yet another R called reenactment. And the important part of that word is the act. It is the reenactment that causes the acting out behaviors, as they're often labeled, that bring people to our door. And what their brain literally is doing is reliving the trauma in the present moment without their thinking brain knowing it. And this reenactment is not a choice. It comes from the part of the brain we don't have conscious control over. And it feels like the trauma is happening all over again. It's a very lonely, frightening place to be. And when they're done, it may look like they have gotten some relief, but they have not. That person is caught in the trauma of the past and reliving it in the present moment. They don't feel safe. They are just as frightened now as they were when the trauma happened. And it's not a choice. It's not a relief. And it's something we actually can help them move beyond. Where the 3 R's of trauma resolution comes in is that the first one, re-experiencing, can happen depending on how we react to someone's reenactment. If we reflect the fear that we see and we honor that they had the courage to show us that fear, and we connect them with the fact that they're safe and in the here and now right now, we literally allow that person to re-experience that trauma, not from a place of being alone, but from a place of connection. So when you get to re-experience that trauma with a safe other, whether it's through drawing or writing, the person no longer feels alone in that moment. And it literally takes them off their hamster wheel of reenactment. You have helped heal their brain. So the second R is when we honor what they've done to survive, and that allows their brain to release their trauma from the central nervous system and put it in the memory center of the brain where it belongs. We are helping their brain release their trauma, and we're also giving them dignity for the survival they have already done that has gone unrecognized. And then the third R is my favorite, because once you've released it, you are aware that the trauma has happened, but it is no longer the central organizing feature of your life. Then all the energy your brain was taking up, keeping you in the past and looking out for the future and not allowing you to live in your present moment, is freed up for you to decide what you want for your present and your future. You literally now can connect with people, feel safe enough to reorganize your life around what you want your life to be.
Okay. So the key takeaway is depending on how we as providers respond to someone's reenactment, it can cause a person to either re-experience their trauma or it can cause them to process their trauma in a realistic way. So giving someone the space without judgment to feel pain, to feel their loss, or any emotion that they're feeling, it connects the detailed memory of the event. So when we honor what a person has done to survive, we allow their brain to release the trauma from the central nervous system and put it in the memory center of the brain where it belongs. So a person can live their life without feeling compelled to relive or repeat their traumatic experience. So once the trauma has been released, you are, or the person is aware that the trauma has happened, but they are no longer experiencing or seeing that trauma as a clear or recurring danger in the present moment. So here are some keys to providing trauma-informed care. So we need to assume that all clients have experienced trauma in some form or another throughout some part of their life, okay? Be mindful of your wording when you're dealing with people who have experienced trauma. So asking what has happened to you versus what's wrong with you is generally a more empathetic question. And it's a helpful approach because it focuses on understanding the person's experiences rather than immediately judging or labeling them. Understanding the vulnerabilities and triggers of trauma survivors is crucial for providing supportive care and preventing individuals from being re-traumatized. Um, so by recognizing these factors, providers can create safer environments and tailor interventions to work with those individuals' specific needs. Trauma-informed care recognizes that survivors need to be respected, they need to be informed, they need to be connected, and they also need to be hopeful regarding their recovery. This emphasizes a collaborative approach and focuses on the individual's strengths rather than focusing on their deficits. You also need to understand that there's a strong correlation between experiencing trauma and the development of various symptoms like depression and anxiety, or even substance abuse and eating disorders. So trauma-informed care, it prioritizes creating a calm and nurturing environment. So by understanding the impact of trauma, ensuring safety and fostering trust throughout consistent practices and responsive relationships, that is all a part of trauma-informed care. Again, be conscious of a person's demeanor. So for example, if, like you see here, if someone is beginning to move from maybe they're calm in the beginning of their session and then they start to escalate and then they move to a state of emergency, you need to make sure you are modeling the behavior you want to see. So you should remain calm, you should be compassionate, you need to adjust. Your individual doesn't need to adjust. And then again, be aware of your language that you're using. So certain words or phrases can inadvertently trigger traumatic memories or emotions within an individual, and that can cause distress and it can hinder their recovery. So you want to use language that is clear, that's honest, and it's also respectful. So we want to make sure we are focusing on the individual's identity and their humanity rather than focusing on their trauma, their condition, or even their diagnosis. So for example, instead of saying a traumatized child, you can flip that around and you can say, well, a child who has experienced trauma. So something that simple can make someone feel safe and secure. So let's look at adverse childhood experiences, or ACEs, and how they relate to trauma. So ACEs are defined as potentially traumatic events that occur in childhood. ACEs can include violence, abuse, and growing up in a family with mental health or even substance use problems. So these experiences, particularly when severe or if they're frequent or even prolonged, those can trigger a toxic stress response in children. So toxic stress stemming from adverse childhood experiences can significantly alter an individual's brain development, and it can impact a child's stress response. Potentially, it can lead to long-term health problems and even behavioral problems in adulthood. So I promise this is the last video of today, but this is going to give us an overview as to what is adverse childhood experiences.
A child's experiences early in life are important building blocks for the developing brain. Genes, nature, are like the blueprint. They provide the basic framework for brain development. However, genes do not design the brain completely. Environmental influences, nurture, fine-tune how the brain works by shaping which brain connections get used. Connections that are used more grow stronger and more permanent, whereas ones that do not get much use fade away. Together, genes and the environment build the foundation for all future development. Safe, stable, and nurturing relationships early in life lead to healthy development. But children's brains capture other experiences as well. Stressful events. However, not all stress is bad. Positive stress involves normal childhood experiences, like starting daycare or meeting a new person for the first time. This stress is essential for healthy development because it helps children develop coping skills and confidence. But when stress is frequent, chronic, and uncontrolled, it is toxic to children, especially when they do not have a caregiver to provide support or buffer the stress. Adverse childhood experiences, ACEs, such as abuse, neglect, exposure to intimate partner violence, parental depression or addiction, and poverty, are toxic stressors which could lead to lifelong changes in learning and behavior. ACEs early in development can impact social, emotional, and cognitive functioning, increased risk-taking behavior such as drinking and substance use, and increased risk of disease, disability, and social problems later in life. The question is, how do adverse childhood experiences impact a lifelong development? One of the most important systems in our body is our stress system. It's activated when we experience stress. We become alert, our heart rate increases, and so do our stress hormone levels, cortisol and adrenaline. Our body is ready to react, what is known as fight or flight. A short period of time after the stress is over, or if a child receives support from a caregiver, the stress response turns off and the body returns to a normal state. Adverse childhood experiences create stress responses that stay active, and without the support of a caregiver, the system has difficulty shutting off completely. This constant and prolonged activation can affect immune system functioning and increase the chances of sickness, infection, and disease. Prolonged activation of stress hormones is also toxic to the brain. Certain areas of the brain are more vulnerable to toxic stress, including the executive center or the brain's control center, an area important for solving complex problems, attention, reasoning, impulsivity, inhibition, and learning. A second area is the emotional center, the brain's alarm system, which is involved in processing and interpreting emotions and the ability to control impulses. The third area is the memory and learning center, the brain's filing cabinet, which plays a major role in learning and the formation and retrieval of memories. Science shows that adverse childhood experiences impact all of these brain centers. Behaviorally, what we begin to see is emotional distress, poor emotion regulation, greater impulsivity, learning difficulties, and physical and mental health problems. More recently, science has begun to look at how ACEs cause changes in gene expression through a process called epigenetics, which helps us understand how nature and nurture interact. Epigenetics causes changes in the way genes work without changing the DNA code itself. This occurs through chemical changes influencing how the code is used. In other words, genes are like the hardware in a computer. They determine the boundaries of what is possible. However, we need an operating system to tell the hardware what to do. Epigenetics is like the operating system directing the function of a gene's DNA hardware. The genes we are born with are the genes that we have for life, but experiences like nutrition, exercise, smoking, stressors, and relationships all affect our biology. Adverse childhood experiences are associated with epigenetic changes related to stress, brain development, cognition, and systems associated with mental and physical health. Changes that happen early in brain development are more likely to be enduring and are possibly passed on to future generations as well. The good news is that positive, supportive relationships at any stage in life can make a difference. However, supporting families and children early on will help prevent many of these negative outcomes. One of the key ingredients for healthy development is having warm, loving, and actively engaged caregivers. This involves promoting serve and return interactions, where caregivers actively and warmly engage with the child, making eye contact, responding to sounds, words, gestures, emotional needs, and sharing experiences like reading and play. Providing programs that support caregivers to strengthen these abilities are the blocks that build healthy foundations for life.
Okay, so that was an introduction into adverse childhood experiences, also known as ACEs. So let's look at what tools we can use as providers to determine if a person has experienced any type of adverse childhood experiences. So Kim has went ahead and she has put this handout in the chat for you so that you can utilize it with your individuals. But here you see, this is the ACE questionnaire. So this is a tool that is used to assess and measure a person's exposure to potentially traumatic events or even stressful situations that they experienced during childhood. Um, it's helping them to identify potential risks for future health and even their well-being. So the ACE questionnaire is also known as the ACE-10. It is a 10-question survey that explores a person's experiences with abuse, neglect, and household dysfunction. So trauma, particularly during childhood, has a striking and well-documented association with physical and mental health problems, including chronic diseases, substance abuse, and mental illnesses like depression and PTSD. So the seminal ACE study conducted by the CDC and I believe Kaiser Permanente, that demonstrates a strong relationship between ACEs and increased odds of developing various health and mental health conditions in adulthood. So ACEs are also strongly correlated with the range of negative health outcomes in adulthood. So if we look at this last bullet point here on your screen, it shows you that people who have experienced 4 or more categories of ACEs, they have 2 times more the rate of developing lung and liver diseases, 3 times the rate of depression, approximately 3 times the rate of alcoholism, 11 times the rate of intravenous drug use, and 14 times the rate of attempted suicide. So, meaning the greater number of developmental traumas experienced in childhood, that's going to increase the odds that in adulthood, a person can experience illnesses, engage in high risk health behaviors. So here you see the 3 types of ACEs. So developmental trauma is a term that is used to describe childhood trauma such as chronic abuse, neglect, and household dysfunction. So when a child is exposed to overwhelming stress, um, and their caregiver doesn't help them to reduce their stress, or maybe their caregiver is the cause of their stress, the child then experiences developmental trauma. So now let's look at how do we collect trauma history from our individuals. So when it comes to collecting trauma history, this can be a sensitive process where you obtain information about past traumatic experiences and their impact on an individual's life currently. So due to the subject matter, this can be overwhelming. The entire process can be overwhelming for individuals. especially if they don't have some sort of a healthy coping mechanism in place already. So what you want to do in place of asking like detailed questions, you want to look for what are called trauma markers. So trauma markers are signs and symptoms that can indicate a person has experienced trauma, including changes in like their behavior. You're going to look at their physical reactions to events, look at what type of emotional distress they exhibit. For clients who have a mental illness and are suffering from substance abuse, or maybe they have obesity or even diabetes, there's a very good chance that at some point in their life they experience some sort of traumatic experience or multiple experiences, again, within their life. So again, when it comes to inquiring about trauma with your individuals in the context of trauma-informed care, we want to assume that there is a history of trauma without directly asking an individual. Now, I know that can seem counterintuitive. However, that is a very valid approach to take. So instead of focusing on the details of past trauma, screening for the impacts of trauma, such as anxiety or depression or substance use and chronic pain, that can be a more sensitive and effective approach to identifying and then addressing potential trauma-related issues. You want to inquire about trauma using open-ended questions. So start with general, non-leading questions about experiences and feelings, and allow the individuals to share at their own pace. Allow them to find their comfort level and rest in that comfort level. You want to avoid using specific or even accusatory language. And then lastly, you want to use a structured tool to explore past trauma experiences like that adverse childhood experience questionnaire that we just looked at. So when it comes to your approach in working with individuals, you want to use a trauma lens. So again, you're assuming that a client's trauma has happened and that those things have attributed or contributed to their current medical conditions. Use a trauma-informed approach. So integrating a trauma-informed approach into healthcare alongside traditional medical therapies, that can lead to better patient outcomes and experiences by recognizing the impact of trauma and creating a safe and supportive environment for healing for your individuals. Behavior is often attributed to personality disorders like borderline personality disorder, can also be significant symptoms of trauma and PTSD, including emotional dysregulation, unstable relationships, and self-destructive behaviors. So these two can be considered markers for trauma, and those can include being reactive, being easily triggered, or easily offended, angered, or even withdrawn. Another factor to consider is that it is important to acknowledge that many providers and staff themselves have trauma histories. So we have to be aware that working with patients or individuals with severe illnesses and significant histories of trauma can cause vicarious trauma. So being conscious and aware of our own traumas can help us maintain a professional and therapeutic stance towards patients with trauma. So when we use guidelines for inquiring about trauma and past trauma, it's known to be less triggering or less dangerous for our individuals, but it's also less overwhelming for us as providers. There is nothing that you as a provider needs to do when a person is revealing their history of trauma to you other than hear it. You just need to acknowledge that you heard them, and then you want to thank them for trusting you with this information. The most important thing you can do is to offer statements of empathy and support. And just by simply acknowledge that you are, it's helpful that the individual even had the courage to tell you. All right, so here are the resources that were used for creating this training. And that concludes our training. Are there any questions, comments, concerns? If not, that's perfectly fine. But we also do have a survey here for you guys. If you wouldn't mind going ahead and taking this survey and letting us know how this training went. Kim, I'll turn it over to you.
Okay, great. Thank you, Letitia. She did a great job giving us a lot of really important information, not only for the residents that we work with, but maybe also personally, because like she explained, trauma is so prevalent across everybody that we work with, people that we, encounter in our daily lives. So thank you, Letitia, for doing a great job of explaining that to us all. As I put in the chat, the recording from today, as well as the PowerPoint and the handout Letitia gave you, can be obtained either through an email that will come later today or first thing tomorrow morning from Kayla Bell, or you may also get it perhaps from the development contact person who invited you to the training today. So appreciate your attention. Hopefully you took something away from today and hope to see you at next month's training. So talk to you soon. Have a great week.